Hello, this is Debu Tripathy. I'm the editor-in-chief of Cure Magazine, and I'm proud to bring you a video blog, which is a new feature for us. Today, there were several updates in the area of HER2-new breast cancer. And HER2-new represents a very important target in breast cancer. It has really changed the natural history. We are able to treat it much more effectively. In the early stage, we can cure a higher rate of patients, and even in advanced stage disease, we're still not able to cure people. We haven't crossed the curability threshold, but people are living longer, they're living better quality of lives, but we clearly have a ways to go. So the HER2-new pathway has been explored extensively in the laboratory, and what we have learned over the years is that you can target it at multiple levels with either antibodies or small molecule inhibitors that inhibit the enzymatic part of HER2, the part that turns on other growth factor pathways. So other drugs like Tykerb or lapatinib have been approved in patients who progress after Herceptin. However, combining the two agents really makes a lot of sense, and in the laboratory does get you more bang for the buck, if you will. So several studies now have matured to the point where we can understand whether or not it may actually be a good strategy to use in the clinic. And today we had the first presentation from a study that's large enough that will actually affect practice. This study is known as the Cleopatra study. It's a study for patients with advanced breast cancer, HER2-positive, and they were treated with Taxotere and Herceptin, which is one of the standard treatments, or Taxotere plus Herceptin plus another antibody called pertuzumab, which also binds the HER2 receptor in a slightly different way. It keeps the HER2 receptor from binding to other receptors and sending a signal down to the inner part of the cell to make it grow. So when these two antibodies were combined, it delayed progression significantly. In fact, it was about a 6-month delay, which may not sound like a lot, but it's actually a bigger step than we've taken in previous trials. In fact, when Herceptin was first introduced, it didn't even lead to this big a benefit compared to chemotherapy alone. So there was also a small survival benefit. It's a little too early to attach statistical significance to the survival benefit, but certainly it is delaying progression. And it did so without introducing a lot of new side effects. There was a little more diarrhea, but other than that, it did not seem to cause any problems. There's a small risk with cardiac problems on Herceptin, and we didn't see that it was augmented with the addition of the second antibody, pertuzumab. So this has now been sent to the Food and Drug Administration for approval. It's expected that they will review this in May or June, and it may be available as soon as then. However, the sobering part of the story is that we still need to understand who to best treat with these combinations. Because as you might imagine, as in the years to come, we're going to be adding more and more drugs that may give us incremental benefits. And what we want to do is intelligently really choose who should be the best candidate for this combination versus that combination. And this area is actually lagging further behind. In other presentations over the course of this meeting, some of the molecular markers and protein markers that we think might identify the people that really benefit, that are super sensitive to therapy, have not really materialized the way we'd like to see them. So we need to go back to the drawing board in that regard. But this is work that's still in progress. All of the clinical trials now collect tissue so we can explore these so-called biomarkers. So I think that this is an important step forward, and it's one of the bigger steps, which is why it has created such a buzz. And there are more HER2 drugs that are coming along. There's another drug called TDM1, which is being explored in a randomized trial that should be completed soon. And the antibody pertuzumab that was reported today is also now moving into early stage trials, and those studies are already underway. So it may be that we can even use it in earlier stage disease to prevent recurrences in the first place, which is what we really want to do. So reporting from San Antonio, again, this is Debu Tripathy, and thanks for joining us for this update.